You are listening to the Intelligent Vocalist Podcast, episode 87.
Welcome to the Intelligent Vocalist with John Henny. This is the podcast dedicated to help you be a smarter, better, more informed singer. And now, your host for the Intelligent Vocalist, John Henny.
Hey there, this is John Henny. Welcome back to another edition of The Intelligent Vocalist. I do so appreciate you spending your precious listening time with me. Today, I am really excited to present the first part of my two-part interview with Dr. Reena Gupta. Dr. Gupta is a leading ear, nose, and throat doctor in Los Angeles. And in her practice, she specializes in professional voice users, and she sees everyone from voiceover artists to professional business people to musical superstars. It's a wide-ranging practice, but she's also very passionate about helping the vocal community in general, and she has a number of resources we'll talk about. Today, we go into when you should see an ENT, how voice teachers should listen to singers' voices and what to listen for, the online resources you should be aware of, how to know you're getting a proper evaluation from an ear, nose, and throat doctor. We delve into nodules and much more, so you really need to listen to this. So without further ado, I present part one of Dr. Reena Gupta. I am here with Dr. Reena Gupta. Reena, thank you so much for joining me today.
Thank you so much for having me. I'm so excited.
I am totally excited. And what I did is I reached out to my email list and I got a bunch of questions for you.
Awesome. Let's do it.
So we're just going to kind of go through the greatest ENT hits, if you will,
All right.
of questions. One of the first ones is for voice teachers. We'll have students come in. We don't know if they maybe have a naturally gruffy voice or not. And so we start thinking, should we send them to the ear, nose, and throat doctor? Not sure, because it stresses students out.
Yeah, and teachers, I'm sure.
Yeah.
Because you're worried about hurting them.
You're worried about hurting them, but you're also worried about sending them to the doctor unnecessarily. And as soon as you mention the doctor, you can see like the fear come in their eyes.
Is that right?
Oh, yeah. Oh, because as soon as you talk about an ENT, they think there's something wrong with my voice. And the first place they go is nodules, of course.
Oh, that's fascinating.
Yeah.
Well, I feel like we should flip that script to start with.
Sure.
So that maybe the answer to your question is, when is the right time to go to a laryngologist? Yes. Right. It's always right, in my opinion, as a singer, to go to a laryngologist when you're starting on a singing career. So I think of it like a sports physical, right? Like you're about to go on a period of intensive voice use, or you're about to use a body part intensely, potentially for your entire career. Doesn't it make sense to check that body part before and know about any potential for injury, any other medical problems that are affecting that body part, right? So you have, I think it's like when you're doing cheerleaders or cheerleading and you're about to engage in it, you have to have a sports physical, and they're asking questions about your heart history and your family history of your heart. And that's going to help them to know, can your body handle this kind of demand, right? So what I might do is I might say, do you have any history of allergies, any history of these symptoms? And all we're doing is preventing the very things that we're worried about. And so I would say for sure, my sort of bias is to get checked out at any point when you're starting your career. Get a nice, clean baseline. Now, there are absolutely people who have a naturally raspy voice. I find that those people are in the minority, that there are more people who have subtle or slight issues, and usually it is something simple like allergies or like, a medication side effect, where when we look at them, we can figure that out and say, okay, how can we manage this so we clear out some of that raspiness? Or say we can't clear it out, know that that is an area that makes you a little bit more vulnerable. So how do we put up warning signs? How do we know what is going to bother you, and how do we prevent you from getting any worse, right? So it's an opportunity to identify things that you can intervene upon to make you a healthier singer. And then I would say my other sort of soapbox is to pivot from ENT to laryngology. I don't know if you caught that. I kind of
I did catch that.
I changed your verbiage.
Yes.
So an ENT is a general ear, nose, and throat physician, right? This is somebody who has gone through 5 years of training, which is fantastic. I did it myself. In all of ears, all of nose, and all of throat. But I will say that in my 5 years of ENT training, I spent less than 6 months, probably less than 3 months studying the voice, right? So that most ENTs are graduating their training not really knowing how to take care of the voice. So those of us who choose to pursue the care of vocalists do something called a fellowship. And that fellowship is an extra year of training in just voice and the larynx, right? So that's when you're called a laryngologist, is when you've done that extra training. And so in most cities at this point, I would say there probably are laryngologists in most major cities, but there are a lot of ways to connect with one, I think, and certainly with me, even if you're not in my geographic location. And so I would say we now have to start to pivot from just a general ENT. For voice users, we've got to move to a laryngologist.
And then is there a further specialty within laryngologists, maybe ones that really focus on professional voice users?
There's not training for it, but I am an example of what you just described, that technically we would do airway, swallowing, and voice, but I have probably got to about 90% of just professional voice in my practice. If you go to some of the university settings and other places, you're going to see more swallowing and airway and things like that. So I have sub-specialized to just professional voice. And I feel that that's allowed me to detect things differently because 100% of my day, every day, is spent analyzing, assessing, and treating the voice.
So singers who, let's say they're in a geographical area where they don't have access to a laryngologist, what are their options?
I get asked this a lot because I lecture in places all over the world where there aren't necessarily this subspecialty. So one thing that I ask people to at least try to do is, if you're going to a general ENT, try to go somewhere where they will record your exam. Don't have that scope done where they're just looking at the camera with their eye, right? Because you're not going to ever be able to see it yourself, nor do you have any kind of recording that you can use for a second opinion. And most ENTs, I would say at this point, have video capability. So now that you have your video, you can reach out, in my example, through my website, Voice Doctor LA, and ask for a remote consultation. You upload the video, you fill out a little form, and then we'll set up, I do them in Australia and London, all over the world, because that is a level of care that's a little harder to access out of a major metropolitan American city. That all said, I will do that as well, even without a video. I've had one young lady in particular that I'm treating in Australia who doesn't have any ability to access a video recording. But through voice testing and task testing, I'll have her do different things. I'm listening to her story. We're still able to refine down a diagnosis to close. And now we're sort of figuring out how do we get her the care she needs. And we're sending her to somebody who can do certain tests for her, give that data back to me, and then we can go from there.
And when you talk about, now this is interesting because you're using sound to analyze, which would be another bit of a voice teacher question.
Yes.
What to listen for?
Yeah. You have to train your ear and your brain. And it's not as hard as we think. I think that we tend to doubt ourselves a little bit. So we hear things and we think, oh, it's probably nothing. I don't want to ring the alarm bell. But I don't know any singer who didn't know they were injured. Like when I have an injured singer, there's always something that like, it doesn't feel right. It doesn't sound right. And their coach always knows too. All of that said, I would rather get a coach refer and have it be normal than worry about referring a normal and being made fun of, quote unquote, because that shouldn't exist. But ear training is something everybody has the capability of doing. Here's how I develop my ear, and this is where referring is going to become really helpful for a voice teacher. You listen first. You don't jump into the picture. You listen first and listen to their story as well as the sound of their voice, and not just their singing voice, but their speaking voice. The full range, quiet singing, loud singing, belting, mixing, every single task you can put them through, and just listen for when things fall apart or don't. And that's how you're going to start to identify, okay, maybe something is not quite right, and it's becoming pattern recognition at that point. Now, my added advantage is then I can look, and immediately I'm now firming up that relationship between what I heard and what the diagnosis actually is, right? So I can now see it and be like, yep, I thought it was nodules, and I'm looking, and indeed it is. And so now I can tie a bow around it that a vocal coach and a voice teacher can't necessarily do without that referral. So at the outset, while you're training your ear, you might do that more. You might refer out a little bit more saying, I think I hear something. It sounds nodular. I'm going to send it out. Oh, it was. Now I have this little memory bank of audio patterns, or record it in your own studio. And then when you get your diagnosis, label it nodules 1, nodules 2, nodules 3. And you're going to create a nice little sound bank of things that you can refer to that help you to refine your ear.
That would be amazing if somebody created like a
I might have one already.
whole ear training. Yeah. So, people need to follow you on social media because
People need to.
They need to because you don't just post pictures of your lunch. No.
It's true.
You actually put up case studies.
I do.
And it's rather fascinating.
Yeah, I appreciate you saying that. I really do feel that voice care has been mired in a lot of misinformation and a lot of mythology. And so a lot of what I do is just try to dispel those myths. So I do that 3 ways. I write a lot of articles that are geared towards lay people, the voice user. I want you to be able to understand what I'm saying. I put a ton of pictures and a ton of videos in those articles because I want you to do what I just described. I want you to listen. I want you to see. I want you to understand the story and put all those pieces together for yourself. Then I do on Instagram, for example, and Facebook, I will post cases of the week and little studies and little snippets and voice tips and mythology busters and all of those things as well. Then I wrote a book that also does that, and that's free for download. I do masterclass that you're going to be teaching at, which is a conference to help people to get access to credible information.
Now the book, I have to say, is probably one of the most concise, easy to read manuals on the care of the human voice.
Thank you.
It really is. And I get, when I mention your name, because I reached out to my mail list for questions for you, and I just get back, I love Dr. Gupta. Her book is amazing. I've taken so many notes. How do people get your book? Because the other great thing you've done is your book is permanently free.
It is permanently free.
Yeah.
I got yelled at by a lot of marketers for that. But again, I just really feel that the more information a voice user has, number 1, we're avoiding injury, which is my primary goal. And number 2, I'm helping that singer be an advocate for themselves so that when they go and they get that poor quality exam, they know to say, hey, look, I know that I'm supposed to have a rigid strobe by a laryngologist. How do I get that? So I just put it on my website, which is voicedoctorla.com, and you fill out a little form, and it'll take you either to one of a few platforms where you can download it for free. Works on your phone, works on your tablet, whatever, on your desktop, whatever you want. And it is full of pictures and videos and vocal health information, and also information about how your voice works. Because once you know that, you become the best advocate for yourself. And that really is my goal.
It's perfect. Now, you just mentioned something, though, rigid scope. Mm-hmm. So because a lot of people, they'll go to the ENT and they talk about the camera going up their nose. Mm-hmm. And there's a difference in the level of quality diagnosis between these instruments.
It is the difference between ENT and laryngology. When I first started practicing, the person that I worked with said, okay, what do you need? And I said, I can do anything. I can work around almost anything, but I need a rigid strobe. I need a stroboscopy tower.
And those are a little more expensive?
They are, I believe, 100 times the cost of an already expensive piece of equipment. But it has paid for itself 1,000 times over in accuracy of diagnosis and better management of my patients. I can't go to bed at night if I don't think I've done the best possible evaluation and care of my patients. So what that exam looks like is your laryngologist should be holding onto your tongue and passing a scope in through your mouth. And this is like maybe a 10-inch long rigid scope. It's inflexible. It cannot bend. And you're basically just going to say E, and it'll take about 30 seconds with somebody who's good at, doing these exams. And there's a strobe light that goes at the same time, and it kind of synchronizes with the pitch of your voice. And what that does is it gives me a slow motion view of the vibration of your vocal cords. And all of these videos, again, they're on the website. They're on every social media platform I have, so that people can start to see those videos and say, wait, that's not what I saw when I went to the ENT, and start to understand the differences and how much you're going to catch when you do the right exam. It is basically not it doesn't count unless you do that. That's the exam a singer needs. That's the exam any professional voice user needs.
Because the danger, as I understand it, is with the other type of scope. The common misdiagnosis is nodules.
Nodules. So why that happens is, case in point, with mucus. So our cords close in the middle first, and then the rest kind of closes beyond that. But when we keep closing in the middle 200 times a second, mucus, if it's present, will accumulate in the middle. And it will look like two little white chalky things in the middle of your vocal cords. So if you remember when we were talking about how much voice training we get in our ENT residency, so in those 1 to 3 months of studying voice, we are taught that there are bumps in the middle of the cord. Those are nodules. Done, case closed, right? And that is what happens when you don't get that added expertise in voice. Now, when you zoom in, use a strobe, illuminate it, understand voice, you will see that all that ever was mucus in the middle. But people treat the picture, right? So I get frustrated as well because I'm like, you don't even sound nodular. So when I'm scoping you, if I think I'm seeing nodules, but you don't sound it, then I'm not diagnosing you with that. Then I know I've missed something, right? So the next layer of frustration is when ENTs aren't putting those data points together. Your story has to go with the sound of your voice, has to go with the picture. Where we get into trouble is nobody listens to the story anymore because there's not time. Nobody knows what to listen to in the quality of the voice. And so all they're doing is getting a picture and they're going with what they were taught 30 years ago for 1 month by somebody who probably didn't know what they were doing.
And that's also part of the state of, I'm sure, a whole nother conversation, the medical industry, insurance, patient load, all of these things.
Exactly.
Yeah.
What can you, I mean, I spend an hour with a new patient and
which is unheard of.
Unheard of. You get 10 minutes if you're lucky with a doctor these days. But I have them singing in my office. We were just talking about soundproofing my office because I'm starting to bother my partners who don't see singers. But I tell my patients, I need to hear you belt. I need to hear you go to the top of your range. And if you imagine a classical opera singer going to the top of her range in the middle of a busy office day, you get why we need soundproofing. But I'm getting something from that sound check that I would never get in a 10-minute quickie scope in the nose.
Perfect. And let's talk about nodules a little bit, because this is almost the boogeyman for singers, and singers live in constant fear. And there's confusion about if you have to get surgery for nodules, and do they destroy your voice, and can you just get them in one gig? I mean, they think that nodules are almost this instant, like it's a switch that just suddenly comes on.
Which is fascinating because of all the vocal injuries, those take the longest to develop. Nodules are definitely not an overnight phenomenon. They are usually 3 to 6 months of slow, steady overuse, misuse, but usually triggered by some event like an illness or something like that, right? But I agree with you. They are sort of like the boogeyman, and they get a bit of a bad rap because that all came from what we were just talking about. A lot of misdiagnosis, a lot of misunderstanding about how vocal cords get injured. Again, I treat all voice people, and I would say nodules are the least common diagnosis that I make.
That's huge.
Right?
Yeah, that bears repeating because everybody thinks that they're worried about, do I have nodules?
Absolutely.
One bad vocal night, I have nodules.
Did you read the intro in the book? It's exactly what I started with saying is I'm just worried I have nodules. I hear it all the time too. And I say, well, when did your symptoms start? And they say a week ago. And I'm like, well, you didn't develop nodules in a week, but I understand because that erroneous information has just penetrated this voice community. And that is what we're doing, right? We are trying to correct all that, but it's going to take time. There are injuries that happen within a week, but nodules ain't one of them. And there was this other sort of benchmark that you never do operate on nodules. And I do sometimes. There are absolutely nodules that don't respond to voice therapy. But at the end of the day, nodules are no more a career ender than any other injury. They just have to be managed. And all vocal injury happens pretty much the same way. This is what we think right now. You have bruising that can occur in your vocal cords for a number of reasons. Usually in my singers, what I find is that it is singing while sick. You're sick, your cords are swollen, you're going out to that one gig, and you bruise a little bit. That just means you've hit the cords a little too hard when they were in a fragile state. Even so, not the end of the world. you vocal rest, and that bruise goes away and you're off to the races. But how often do we vocal rest for a few days after a gig? We don't, right? And so you're talking and you're going back to rehearsal and you're singing, and that bruising is still there and it creates inflammation. And from that inflammation, the body starts to form these changes to the tissue, which can either be nodules or something similar, something a little stiffer, a little scarred. And so that's really how they form, but it's not an overnight phenomenon. So that if you know you're hoarse after you do a gig and you rest your voice and it goes back to normal, you're done. You don't have to worry anymore. They're not going to sneak up on you. Nodules are not something sneaky. They are something that you have probably pretended you don't have a problem for about 3 months before they are something to be reckoned with. And even then, they are reversible.
And I would imagine the sooner you catch them, the less likely you are to have surgery.
The sooner you catch them, the less likely you are to have surgery, and the shorter time it will take for them to go away on their own as well. The longer you wait on any injury for it to get better, the longer it will take to get better.
So let's say we've got the singer, you've got a string of important gigs, you're not feeling well, you sing, you feel a little hoarse. What can they do in terms of vocal rest and taking care of themselves if they have another gig that next day or 2 days later?
The next day or 2 days later, that's a very common scenario. I'm fine with that. You're silent when you can be, and you sing when you need to. And then the next day, same thing, silent and singing. If you can get checked out in those days, that's ideal, right? That's going to help us to know, did you bruise or are you just swollen? Are you sick and we need to manage that illness so that we can manage that inflammation? Or do we need to vocal rest you? So that's really where you need a good laryngologist in your pocket to say, this is what's going on and how do we handle it? I think that the two things that get singers are this sort of martyr mentality of the show must go on, which I get, but it's not where the show must go on and I can have absolutely no help and nobody can evaluate me and nobody can check me out to know what's going on and I won't take any medication. The show probably does need to go on, but with medical help, with appropriate medical help, it can go on safely. And that should be the goal, right? So if you identify those things, I've taken singers through a whole weekend of Hollywood Bowl shows with a hemorrhage, right? With a bruised vocal cord, but it has to be done the right way and with really close monitoring to prevent it from becoming a problem. But it is doable. Most of my singers can't be canceling willy-nilly. So we just have to do the dance.
Right. And there's also the pressure from the other musicians if they're in a band, because bass players can play even if they're racked with the flu. Mm-hmm. But singers it's a completely different instrument.
Yeah. I mean, singers get allergies and they could be sidelined. It's difficult because maybe like 80% of respiratory conditions are going to affect your voice, right? You get a cold, you have sinusitis, you have allergies, you have asthma, all of that stuff affects your voice. So unfortunately for singers, their athletic body part is right in the crossroads of a lot of medical problems. And so managing those aggressively is the best thing a singer can do. I mean, you can't be lazy about your medical care. You are an athlete of the voice. No other athlete neglects their body part like singers do because you don't get the same sensory feedback, right? You're not getting pain. And you're also taught like a little bit of hoarseness is okay. A little bit of pain is okay, right? Because it is that sort of culture of, everyone's relying on me. I got to do this. This is a really important gig. Just imagine what any other athlete would do in your situation and do the same thing. They're not necessarily going to be benched, but they probably are going to see a doctor, see a trainer. How do I get through this next performance safely?
So in just a few minutes left, tell us a little bit more about the Voice Masterclass.
Oh, I'm so excited about Vocal Masterclass this year. We are in our 5th year. It is a conference, but it is actually a fundraising conference. It's a conference for a cause, is what we say. It is a fundraiser for Osborne Head and Neck Foundation, which I am a volunteer for, and we provide care throughout the entire world for those who don't have access to it. We just got back from Peru maybe like 2 or 3 months ago with funds from meetings like this and things and other fundraisers that we've done. But essentially, this year we've expanded it to a 3-day course. There's one day that is all really artist focused. So we have singers, audiobook narrators, voiceover artists, game artists, all of those people are really going to learn about how to take care of their voice, how to do different vocal techniques more healthfully, screaming, belting, warming up, cooling down, all the things that an artist needs. That's going to be one day, but wrapped around that for 3 days.
That's the Saturday, right?
That's the Saturday,
Yeah.
exactly. But the 3-day course is really going to be more advanced teacher training as well as singer, like more immersive singer training. So in the Friday, Saturday, Sunday course, you're going to really learn in-depth techniques for growing your studio, having different techniques in your pocket for your students, identifying injury, ear training, as we talked about. How do I hear this? Laryngeal massage and manipulation, which is another huge thing right now. John, I think you might remember that you're teaching at masterclass this year, so you can tell us what you're doing. But it's going to be really the A to Z for singer, artist, voiceover artist, and vocal coach. It's going to be fantastic this year.
Yeah, I've got 2 classes on the Friday.
Yes.
So I'm going to do a class on practical voice science, and then another class on teaching high belt.
I mean, I don't know a coach who does not want to learn techniques in teaching high belt. This is how musical theater is written right now, right? This is where pop is going, is how do you belt that D? How do you belt that E? And so to have extra techniques in your pocket is priceless.
Yeah, so I'm really looking forward to that. So we're going to cut right here, and then we are going to have a part 2
All right.
with Dr. Gupta. So we will see you on the next episode.
Thank you.
I will have part 2 available very soon. Remember, The Intelligent Vocalist, I'm now publishing 2 podcasts a week. So we'll see how that's going. There seems to be growing interest in this podcast, so I am doing my best to get the information to you as quickly as I can paddle. If you want the links to the things we discussed, how to get Dr. Gupta's book, the vocal masterclass that's upcoming, go to johnhaney.com/87 for episode 87, and you can get the show notes there. You can also sign up for my email list if you are so inclined. And until next time, to better singing. Thank you so much. Bye-bye.